Hello guys, welcome back to my channel Life of Pyramids with Salon. In today's video, I am going to tell you all about a very important drug which was asked for my Viva question, that is sodium nitroprusside. So I'll talk about the classification of sodium nitroprusside, mechanism of action, how it acts on the body, then its indications, contraindications, doses and special points regarding it. Let's break the drug name. Okay, sodium nitroprusside. So sodium, it is a organic compound. Okay, nitroprusside, nitro, it is a nitrogen and oxygen group, and proside, it shows a Persian blue color, basically resembles a compound which is a chemical structure related to it. Okay, now coming to the classification of drugs, sodium nitroprusside, so it comes under the class direct acting vasodilator. Okay, it means that when we will give sodium nitroprusside, it will go and cause vasodilation. Okay, vasodilation will cause the blood pressure to fall. Then it is subclassified into nitrate related. Okay, so how it is causing vasodilation? It will release nitric oxide in the body. Okay, so that's why it is subclassified into nitrate related. Then there is one category of sodium nitroprusside. Okay, so it is categorized as emergency antihypertensive drug. Okay, so in case of emergency, if the patient is having very high blood pressure, nitroprusside is used or is a choice of drug for emergency antihypertensive. Okay, so class is direct acting vasodilator, subclass is nitrate related, and category is emergency antihypertensive and vasodilator drug. Now let us know about its mechanism of action. So just now I have classified sodium nitroprusside as a vasodilator. So the main mechanism of it is causing vasodilation and reducing the blood pressure. So let's see how it causes reduced blood pressure. Sodium nitroprusside breaks down in the body to release a compound called nitric oxide. This nitric oxide is a naturally occurring molecule in the body that plays a crucial role in the blood vessel dilation. Okay, now this nitric oxide, which has been released by the sodium nitroprusside in the blood, will go and activate an enzyme called guanylate cyclase. This guanylate cyclase enzyme is an enzyme which is responsible to convert GTP into cGMP. So this GTP is an enzyme which will convert into cGMP. Now cGMP, cyclic guanosine monophosphate, this is a second messenger molecule in various cellular process. Okay, it plays a crucial role in regulating smooth muscle relaxation that will lead to the vasodilation. Okay, so this enzyme will lead to vasodilation. So how it does this? cGMP, cyclic guanosine monophosphate, will relax the smooth muscles in the blood vessels. Now smooth muscles are relaxed. Okay, so what it will do? This will cause vasodilation of both arteries also and vein also. So it has dual benefits of sodium nitroprusside. It is causing arterial dilation also and venous dilation also. So when it causes arterial dilation, it will reduce the afterload, that makes it easier for the heart to pump blood. And when it causes venous dilation, it will reduce the preload, means less blood will return to the heart. Result is rapid fall in the blood pressure. So this is the whole mechanism of action, how sodium nitroprusside works. So basically the mechanism of action is sodium nitroprusside will go into the blood and it breaks down into nitric oxide. This nitric oxide is a very important molecule that is naturally occurring in the body. This nitric oxide will go and activate the enzyme guanylate cyclase. This enzyme is important to convert GTP into cGMP. Okay, this cGMP is a second hormone molecule. Okay, which causes smooth muscle relaxation. Okay, so once smooth muscles is relaxed, it will cause vasodilation. It will cause vasodilation, arterial dilation. So two functions are there of sodium nitroprusside. So when it causes arterial dilation, it will reduce the afterload. It means that it will make the heart function less pump to the blood to the body. And when it is causing venodilation, that is venous dilation, the heart will get less volume of blood to pump. Okay, so basically it is making the heart to work less, it is making the heart to not work faster. Okay, it is making the heart to get less volume of blood. So ultimately sodium nitroprusside, by releasing nitric oxide, it is causing vasodilation by the smooth muscle relaxation and falling in the blood pressure. Talking about the doses of the drug is given intravenous infusion. Normal dose is 0.3 mics per kg per minute, and the range of the dose can be from 0.3 mics per kg to 10 mics per kg per minute. About the indications of the drug, of course, when I am telling this, it is categorized as antihypertensive drug. So it is given in the case of emergency antihypertensive condition when the patient blood pressure rises too high. Okay, then it is given for acute heart failure to make the heart functions less. Acute heart failure, emergency or antihypertensive condition, and then also it is given for controlled hypotension during surgery to minimize or stop or reduce the bleeding. Coming to the next part, that is the complications of the drug. So it can cause, the major complications is hypotension. We are giving the drug to cause hypotension, but in case if it is prolonged or the dose is more, it can lead the patient to fall too much blood pressure and cause hypotension. Then another cause is cyanide toxicity. So when sodium nitroprusside will break, it also releases cyanide in the blood. So it can cause cyanide toxicity. That is another complications for sodium nitroprusside. Then it also causes thiocyanate toxicity. This cyanide will get converted into thiocyanate in the liver, and it will get built up, and it can cause thiocyanate toxicity. Another complication is arrhythmias due to the rapid rise in blood pressure and reducing the blood pressure. This drug can cause arrhythmias also. So these are the complications and indications for sodium nitroprusside. Now I would like to tell few important points related to this drug. Is this drug acts within a seconds when the infusion is started, and it will stop its action very quickly if the infusion is stopped. Okay, whenever sodium nitroprusside is given, always monitor the blood pressure of the patient. Then, as I said, it can cause cyanide toxicity, so the blood test should be done to rule out cyanide toxicity. Then another thing, antidote for cyanide toxicity is sodium thiosulfate and hydroxycobalamin. These are the two antidotes in case of cyanide toxicity because of sodium nitroprusside. Now one easy mnemonics to learn or summarize this topic is sodium nitroprusside, S and P. So S will stand for smooth muscle relaxation. Sodium nitroprusside will cause smooth muscle relaxation. And for nitric oxide release, it will go break down in the blood and it will release nitric oxide. And P will reduce the pressure. So the main function of sodium nitroprusside is reducing the blood pressure. So I hope you all have got some idea about what sodium nitroprusside does and how it's acting. So if you have any confusion, please mention in comment section. Thank you so much guys for listening to my video.